Okay, so I'm going to jump right into the questions. What made you work in the field that you are working in, and how long, or how did you choose your career path?
That's a fascinating question. That would be 45 years ago. I began working in a behavioral healthcare center in St. Louis as a behavioral healthcare technician, and have been in healthcare ever since, in one form or another. And the career path I took was definitely something that was a gift of a path provided by God to lead me to finally work here at Guadalupe Clinic. The fact that I had such a diverse healthcare career, coming here as a paramedic and then being involved on the Life Watch flight team and as a flight paramedic, and then receiving my graduate degree at WSU in healthcare administration, then led to 3 or 4 other administrative type positions that then led me here to serve at Guadalupe Clinic as executive director for the past 5 years. And I firmly believe that, given that healthcare path, that I've really been blessed to actually still even be alive to be able to be here, considering the different things that I've been through and the different extreme situations that I've been involved in pre-hospital care. I really feel blessed to even still be here to be able to serve at Guadalupe Clinic, for that matter. So that's a 2-minute rendition of 45 years.
All right, that's very interesting. What would your typical work day or work week look like here?
So Guadalupe Clinic is open 6 days a week here at this location at South St. Francis, and have been for a number of years. And then our South Clinic is open for 5 days a week, and tonight I go to North Market Street, where our clinic is open in the evenings. So my day consists of administrative duties, answering to 2 board of directors, management of a staff of 20 wonderful people, and then interacting with the volunteer doctors and nurses that make it possible for us to provide health care for a $5 donation, serving the poorest of Wichita that are uninsured. The best part of my day, that wasn't part of the question, but the best part of my day is interacting with the staff, the patients, and the volunteers. That's the best part of my day. That way I can discover what I call mission moments, which are moments where patients share with me how they ended up uninsured, and the wonderful service that we've provided to them by our doctors and our volunteer nurses and our staff. So that's the most important part of my day, is being able to actually be with the patients, which is something I was used to doing for many, many years, providing patient care. However, I can't do that here and don't do that here. But that's the best part of the day.
Awesome. What excites you the most about your job?
The exciting part for me at Guadalupe Clinic is the opportunity to be mission-based and focused in providing health care for free, for a $5 donation. Many of our patients don't have that. The exciting part for me is to be able to reduce all barriers to health care by providing not only quality physician nursing care, but also medications, x-rays, lab, a lot of specialty opportunities for our patients to be able to have that otherwise the patients wouldn't be able to receive. Just to be here and be a part of this mission is the most exciting part of my day.
That's awesome. Do you feel you make a difference or an impact on people? And if so, what specific area of our population do you affect?
I don't necessarily feel like I personally do in my role. I feel like I am the executive director and directing a lot of staff that then are able to provide the infrastructure that then provides a place for our volunteer doctors and nurses to provide the care, and our dozen medical staff to provide quality medical care to individuals, again, that otherwise would not have access to quality health care because of the fact that they are uninsured, and many of them don't have anywhere else to go because of the cost is just prohibitive for them to be able to access quality health care.
Okay. If you would give one piece of advice to someone going down your career path, what would it be and why?
From what I've learned over the past 45 years, my best advice is to listen. If I would have listened more over the years, I might have ended up here 10 or 15 years ago rather than having taken the long way around and just been here 5 years. You have to be willing to listen to those around you, and you also have to listen to God and listen to what is being spoken to you that I don't always and am not always very good at listening to. Those opportunities to listen and ask questions. I found that many times it's just asking, what if? What if and why not? So I think listening and asking, what if, or why not, or why can't we? Because many times along the road, you're told why you shouldn't, why you can't. I'll never forget in graduate school, my instructors and my lead. You're assigned a lead counselor, a lead person for your master's degree, and they advised me that I couldn't take classes full time or work full time in graduate school. And my question was why not?
Right.
And so, and that was good advice at Wichita State, but I was on a job where I was a flight paramedic, and I had a lot of time in between flights to study, to spend quality time, as well as a lot of time off, the way our time was structured. So when we weren't flying, we had days off, and so I just asked why not, and my professor advisor, that's the word, advisor, he said, well, if you think you can, then I guess you should. But I think that's a premier question is why not or what if, along with the always listening and observing.
If you had the opportunity to experience your career path over again, what would you do differently, if anything at all?
Well, if I had the opportunity to restructure it or go back and redo, I spent 19 years on the board of directors here prior to becoming the executive director, and if I had that to live over, I would have been here for those 19 years. I truly feel like we're doing God's work here, and even though I was in mission-based, not-for-profit work and many of the other jobs that I had, throughout my career path, I would have spent those 19 years here at Guadalupe because of the fact that we collectively have the opportunity to impact so many people's lives that otherwise wouldn't have access to quality medical care.
That's good.
That's a great question. I had never ever considered that. having a do-over, and what would I do over?
Mm-hmm.
Great question.
What personal qualities or abilities are important to be successful in your career?
What abilities?
Personal qualities or abilities.
Personal qualities and abilities. Well, I've experienced a lot of different management types and structures over the years that I've not been executive director. So I would have to say, as far as I'm concerned, somebody that's willing to look at process problems and not necessarily always go towards people problems.
Mm-hmm.
I've learned that through Deming and work with other process improvement gurus that about 95 to 99% of the problems are process problems, and you can attribute the 1 to 5% on people problems. So I think it's being willing to look at things in a quality improvement fashion rather than in looking to find somebody who's at fault or a reason to fault anything other than the system, and then step back and take a look at the process and the system rather than it being necessarily people. Most people come to work every day to do a good job, and my job is to provide them the environment in which to do it. And I think probably another very good trait is that listening that I mentioned,
Mm-hmm.
is to be a good listener. If you spend all of your time talking as an executive director, CEO, you just don't get it.
Mm-hmm.
You need to be able to sit down and listen to people and listen to their problems and be willing to meet them where they're at after you understand what it is that they're really trying to say. That goes with our patients too. That's probably one of the highlights of my day is when a patient has a complaint. I don't know if you noticed, but above my door says complaint department.
Oh,
So
yeah.
all the patients that have concerns or complaints come through my office. And again, just listening and validating their concern, and then being able to come up with some sort of reasonable answer, recourse, and being able to then give them a deliverable. And that's not just patients, that's staff as well.
Mm-hmm.
Again, because I think everybody comes to work every day to do a good job, about 95 to 99% of the time.
Definitely.
So you just need to find out why it is that maybe that day wasn't a good day for them, and meet them where they are, and help them through the day. As I tell my leadership team, my job is to give you the tools you need to do your job. So what do you need from me today to do what it is that you need to do to support the rest of this infrastructure that we provide for our volunteer doctors and nurses?
I feel like you could use that in everyday life. How do you see jobs in this field changing your future and others?
I think the role of healthcare in our country is at a real crossroads with the attempted dismantling of the Affordable Care Act. There's going to be a need for more and more clinics like ours, and more people available to provide quality care at a reduced rate and fee. A new way to deliver health care has to be innovated in some doctors and doctors' offices, and others are. In fact, doing that even here in Wichita, I know of a few physicians. So we see more and more people here that are, especially without the penalty now, are turning down the ACA and coming here because the Affordable Care Act is a little bit of an oxymoron in that everybody can't afford it, and that everybody isn't eligible. So the challenge is how to deliver quality health care to every single citizen of Sedgwick County, which there's 70,000 uninsured in Sedgwick County. So what system is going to take care of that? And who is going to take care of that? Another huge challenge for our community that needs to be addressed is healthcare and homes for the homeless. and so that's a huge challenge as well, as more and more people are teetering on the fringe of our society that then fall off the fringe. Who's going to care for them? Who's going to care about them? And who's going to be a hand up in their life? And I hear that so often when people come through here. You know, I didn't have a job and I couldn't get a job because I'm not healthy, and you all have given me my health back. So I have hope now that I can then return to the workforce and get a job. So you know, they go hand in hand, and without good shelter and without good health care, you really are you've fallen off the fringe.
Mm-hmm.
You were living on the edge, and now you're living in an extremely vulnerable time, and so it's our work, God's work that we do to try to help lift these individuals up by providing them with health and hope that they can have a future, and help them through their hardest of times. And I think we just need more of that, and I personally can't thank our donors and our volunteers and our employees that help make that happen, because we're going to have more of that in the future. The generosity of our medical centers and our doctors' offices that are willing to care for those that otherwise wouldn't be cared for.
Is there a time or a person you have encountered that you made a difference in their life, or they made an impact on yours, that you can tell me about?
So there's so many people along the path of my life that have made a huge difference, and guided and directed me. So I'd say in graduate school, it was one of my professors at Wichita State, an anesthesiologist who's now deceased, but that was Dr. Maurice Tinnerow. Made a huge impact on my life and my quest to continue on in graduate school and study and obtain my master's degree. That was a real turning point in my life. You're in undergrad school, and you will know a difference as you go through your job application efforts to find a good paying job, that your bachelor's is required, your master's is preferred, and now it's probably your master's is required for some positions. And if I dig deeper than that, I'd say my father insisted that I graduate from college because he never did. And so I heard that if I were to tune all the way back into my childhood, he insisted that I get my degree because he never did. And he would routinely say, I wouldn't be in the job I'm in if I had gotten my degree. I would be in a position within the same company, but at a higher level if I had my degree. And so, I don't know if that was inspiration or just a swift kick in the pants, but it always resonated with me as I worked, as being out on my own and single, through school, and then married and continued through school, and married with children, continued through school, and the school loans and all that occurred. But it always resonated in the back of my mind that this was the right thing to do. And I think that again was some leadership from the Almighty Father, that he continued to lead me, although I didn't know where I was going. The footsteps in the sand next to you, behind you, in front of you, that he knew that I was to end up here, and that I had to have that inspiration, that degree, to be able to acquire some of the positions that then allowed me to become the executive director here. So of all the people that there's many that I also like to publicly recognize, but those would probably be the three, the top three at this point. But there are many others. Carla Lee, Dr. Lee was inspirational for me for many, many years as well. And just, you have those cheerleaders in your life that help you get through. And there's just so many that I wouldn't be able to list them all.
Definitely. Why do you think your service is so valuable to the society?
Well, I've already talked a little bit about Guadalupe and what we do, but I think that the service that Guadalupe provides is unique in that we reduce all barriers to health care. So there was a lady out in her car that I encountered here at the clinic, back all the way up. I encountered her here at the clinic, and she had seen the doctors, and she was walking out, and she was crying, and I asked her what was wrong, and she shared with me that they were tears of joy. So she sat in that very chair that you're sitting in, because I invited her in to sit down and tell me her story. And it turns out she had been sitting in her car crying for 2 hours before she came in. She was so frightened about what might be wrong. And she hadn't seen a doctor for many years, and she was just very worried about not only that, but if they find out what's wrong, what's it going to cost? And what is this free health care? And would anybody really care that gives free health care? And I found that really fascinating, and I asked her, so what are the tears of joy? And she said, this is the most caring and compassionate clinic I've ever been to. Even my own physicians that I had when I had insurance didn't spend this kind of time and didn't care as much as I felt like they cared here at this clinic. And then I found out that I get my medications, and I get my x-rays, and I get my lab. All those things that I was so worried about were going to cost me a lot of money, and they're all for a $5 donation. And she said, that's the tears of joy that you see, is because this is just an unbelievable place that provides all this. And that's why I'm so blessed to work here, because we even provide transportation. So if you can't get to the doctor, if you can't get here to see the doctor, we'll send a taxi after you. Or if you can't get down to AMS for your lab, we will give you a bus pass so you can get down and back, a one-day bus pass. So literally to reduce all barriers to accessing quality health care. I think that's the answer to what you asked me, and the answer to what we need more of in our community, in our state, and in our country, to find a way to deliver health care that doesn't make people feel like they're going to be burdened with huge amounts of bills, so they delay going to the doctor. And so many people that we see do that. They delay their health care because they're fearful. So reducing all barriers to health care includes reducing the fear associated with the cost and the fear of what might be wrong, and will I be able to be cared for after I come to this clinic?
Yes, I agree. Do you want to add anything else? I'm out of questions for you.
Oh. Well, I think I've already stated this, but I would appreciate being able to say it again. We can't do what we do without our 33 physicians, our 25 volunteer nurses, all these people that volunteer their time and talent. We couldn't do this without all of our donors that are willing to donate of their treasure. So it definitely is a stewardship model. We couldn't do this without the ongoing, not monetary support, but the ongoing support of the Catholic Diocese of Wichita. They entrust in us this opportunity to provide health care, similar to how they entrust another department, the Lord's Diner, to prepare meals and serve food to the hungry. And so it is a real calling that we have as individuals to care for our brothers and sisters. And so I would extend the opportunity for anybody that views this on social media to come and see what we do. Come and see if you could be a part of this wonderful healthcare system that we've been able to put together here at Guadalupe and be able to deliver quality healthcare. If you're interested at all after you've watched this video, to call and come down, and I'll be more than happy to show you around.
Definitely. Alrighty.
Saved by the bell.